Thank you all for those that have joined us. And we kickstart right now, right about now. We had our brief introduction for those that are joining very soon. Just state your name, location, and profession in the chat box. You are welcome. You are welcome to the first quarter webinar of MHDi 2024. According to our schedule, though we are far behind schedule, we are supposed to have the welcome address now by our convener, Mr. Daniel D. Faleti. You may have the floor now, sir. You may have the floor now, sir.
Yeah, good morning to everyone who has joined us for this first quarter webinar of the year 2024 of Mental Health Drive Initiative. I really appreciate us for making out time to join us for this program, and we hope others will join us very soon. I'm using this opportunity to also appreciate the presence of our guest speaker today. You are much welcome for honoring the invitation to take us through today's presentation. As we all know, the presentation for today is on decriminalizing suicide, and we are looking at this as a pathway towards promoting mental health in the lives of individuals, in families, and in the community. And we are hopeful that today we open our eyes of understanding and awareness on the purpose of decriminalizing suicide, and then we'll be able to be equipped to be able to make others aware of this issue also. And then at the end goal of this awareness, this understanding is to make sure that suicide is no longer being criminalized in our society. And then those that are suffering or those that are under the duress of trying to commit suicide or attempting or maybe thinking about it can be well supported, and then at the end we'll be able to promote the mental health of such individuals and even every one of us that are within the society. We'll know that criminalizing suicide has been on in several countries of the world, and then there is this the awareness that suicide needs to be decriminalized, and some countries have already passed the law, some are still considering it, while others are yet to consider this, and we hope that this will give us much more knowledge about why we need to decriminalize suicide, and then pass on the information to others also. Once again, I will welcome you to this webinar, and we hope that it will be an interesting one. The journey is a bit far, but we hope that within the next 1.5 hours we are done with the webinar, and no matter how short it may be, I hope that it will be full of straight interesting sessions for us. There is a video presentation that we are going to watch and discuss, and then the guest speaker can have the floor. Once again, thank you for joining. Over to you. Hello, the moderator. I'm done with the welcome address.
Hello, Mr. Daniel. Please check the chat. Can you hear me?
I can hear you.
Please check the chat.
Okay. Okay. You should be able to unmute yourself now.
Can anyone hear me?
Yeah, we can hear you.
Okay, thank you for that. I've been trying to communicate back. Thank you so much for that brief welcome address. The next on the agenda is presentation about MHDi. MHDi is Mental Health Drive Initiative, and it was convened by our boss, who just finished speaking to us, Mr. Daniel D. Faliti. And what MHDi choose to promote is to promote mental health and also to create awareness as much as possible. Mental health drive on its own is a group of professionals, not only health professionals. If you see the biodata and nice about data, if you see the profile of most of the people in MHDI, you see they are not really health, not everybody is health professionals. So the MHDI drive came about in July 2018, and it came in as an online forum, and it's still being online forum. We are trying to incorporate it into the physical aspect too, and still maintaining the online forum. And many programs have been happening in MHDI. One of it is the webinar, the quarterly webinar that we have every year. Then we have the Art to Art talk, and also there's one that we always have every Friday. Yes, every Friday of I think is every month, first Friday every month, where we discuss about some issues around mental health. And the last discussion was very beautiful, and we had lots of information, lots of brainstorming, and I was really enlightened. And we hope that with this webinar today, would actually get more view into what we are actually saying. Just as our boss has already said, bringing out those points about those countries that have legalized this and those that are still waiting to legalize. I just want you to grab your pen and your paper and make sure you jot things down. That is the essence of this webinar. Please jot things down. And as much as MHDI is also putting out awareness also, we are also putting it into all of us that also attend our programs to also go out there into the community and share and enlighten others. Just as you have also gained this knowledge, you can also pass it on to others. So that's pass on the baton and let's reach someone. Let someone tell someone to tell someone about something. And I hope that you all will enjoy this webinar today. So that's just a brief talk about MHDI. We'll go straight to our next agenda. And please, I want us to watch carefully. We're going to the video presentation and discussion. Video presentation. Hello? We are going
Yeah, we can hear you.
Okay, we are going straight to the video presentation and discussion. It's video presentation and discussion. That means we are still going to discuss about whatever we get, whatever we are watching. And please, every one of us on this call, on this in this meeting, will have something to say. Should get ready to say something about anything you've gotten from the videos we are going to watch. So I tell my boss to have the floor now while we watch the video. Thank you. Please let's mute our mics, please. Thank you. Can my mic be muted, please? Yeah. this. Concentrate.
Okay. Let me try. I think everyone's mic is muted now, so we can go ahead to watch. We have 3 videos that we are going to watch now.
Thoughts about suicide as an option in human life are not uncommon. Acting on suicidal thoughts is a different matter. How can suicidal thoughts turn into a fatal action? Konrad Michel is professor of psychiatry at the University of Bern in Switzerland. Over the last 40 years, he has conducted hundreds of interviews with survivors of suicide attempts. The traditional medical model considers suicide to be a consequence of mental disorders, such as depression. Medical professionals therefore ask suicidal patients primarily about symptoms of mental disorders rather than about their personal reasons for suicide. It is as if medical professionals and suicidal patients speak different languages. Suicidal patients often avoid asking for help, fearing they will be misunderstood or that they might be admitted to a psychiatric hospital against their will. Dr. Michel and Dr. Valak have co-developed a new approach to understand the suicidal person. In 1997, they published a first case study entitled Suicide as a Goal-Directed Action. They found that the immediate goal of a suicidal person is to end a painful and existentially threatening inner experience. The alarm system responds to this existential crisis, as if the person was facing a lion. The amygdala, the brain's alarm system, activates the stress system. In a state of high emotional stress, the emotional brain takes over, overriding the prefrontal cortex, the brain area responsible for rational problem solving. In a highly stressful condition, we can no longer think rationally. We start acting like a robot, with suicide as the immediate goal. Dr. Michel and Dr. Valak then invited patients to tell them about the background of their suicidal crisis. They found that the suicidal crises were often related to earlier negative experiences, such as separation, rejection, violence, and abuse. This left them vulnerable for similar negative experiences, triggering painful emotional memories. People tend to keep these unpleasant feelings to themselves, hiding behind a mask, pretending that everything is okay. This makes things worse. Talking to a trusted person about pain and shame is the first step to be safe. It is important to understand one's own suicidality and to know how to deal with future similar experiences. Brief therapies can effectively reduce suicide risk. One such therapy is ASIP. In a study, this brief therapy reduced the risk of future suicide attempts by 80%. Therapists must take time to listen to the patient's suicide stories, to help them realize suicide is not a rational action, to help them become aware of their personal warning signs, and to know the safety strategies that will keep them safe in the future. Read more in the new book by Konrad Michel, published by Columbia University Press.
So that's the first video. I'll go on to the next video. And this video is a mother's experience of losing her son to suicide, and then we'll be able to get some information from her also for our discussion.
I asked the officer, where is my son now? Is my son still alive? And she told me no. And that's when I broke down. The first attempt I recall was back in 2019. I think he was constantly staying out of the house, which I didn't like it. So I think that caused some strain in the relationship. He was very unhappy at home, but he reached out for help at the time. When he was trying to hurt himself, he actually called his friend. The friend helped to get the police to look for him, and that was how I was being notified. Second attempt was in 2020 when COVID hit. It's the hardest to many people and the lockdown and things like that. So tension also start to rise a bit higher among with family members. So when the circuit breaker released, Paul attempted the second attempt. I saw a change in his character. I saw a change of his attitude towards life, and I thought that he knows what he's doing and he knows what he shouldn't do. He actually asked me out for Mother's Day date. He actually told me that, Mommy, I know you have been worrying for me all this while, and I'm telling you that I'm getting better. I want you to worry for me. I know that what I'm going to do next will be do and then after that, go into get into a course that can enhance my writing skills because he's thinking of doing script writing. So he shared with me about his dreams and his inspiration about what he's going to do. I remember he was still helping his brother to drop out an email because his brother was just entered poly and needed some help. I remember I said goodnight to both of them at the dining table and went to sleep. And next day, which is around 6 a.m., we heard a knock at the door and my dog was barking quite fiercely. And we opened the door and we saw two officers at our door. In my heart, at first I thought, oh, where is Paul? The first thing I went and find him, he's not in his room. When the officer wants to come in, I know that something is very, very bad has happened. And they came to the room, they take a look at the room to confirm that Paul is not in the room and they said to ask us questions. I saw this, the whiteboard in his room. He wrote a statement. He says that, I'm sorry I let everybody down. And I asked the officer, where is my son now? Is my son still alive? And he said, and she told him no. And that's where I broke down. My husband checked on our home CCTV to find out he left home about 1 a.m. that day. When the police found him, it was about 4 a.m. Of course, there's a lot of mixed emotions after I lost Paul. Guilt is one of them. I asked myself if I could have done better as a mother. Anger with myself as a mother. Angry with Paul for making this action to end his life. Angry with COVID. We definitely have to put a toll on his mental health with all the restrictions. And I just do not know how to And then my two other kids, let them know that his brother is just not like that, especially towards Gloria. Because Gloria is quite close to Paul. When he saw his brother lying down in the coffin, she went over and asked the papa to come. She doesn't understand that why the brother can't come home. There is no standard checklist for such signs. And if I were to look back, I would definitely want to do my very best to prevent even the first attempt to happen. Spend one-to-one time with the child. I know sometimes because of our tax schedule, we tend to have a family outing. But sometimes our child just want that undivided attention from you. Giving a listening ear is more important than trying to find solutions for them. Yeah, actually, our kids do know the solution. They know what they should do and they shouldn't do. But they just want someone to listen to them.
Yeah, that's the second video. Sorry, there was some put and back in the video, but I hope we are able to get one or two things from that short clip. The third video will now lead us to what our presenter will be teaching out for us today. Okay. Yeah, where we go.
Around 700,000 people die by suicide every year around the world, with over 79% of cases taking place in low and middle income countries. In Kenya and 20 other countries, suicide is still considered a criminal offense. The penalty in Kenya for attempted suicide is up to 2 years in prison or a fine or both. There are growing calls within the country and from organizations like the World Health Organization to decriminalize suicide, with campaigners saying these laws are making things worse. The BBC's Mercy Juma has more.
And this one is Jasmine.
Dad passed on, right?
Yeah.
Why did he pass on?
He had depression, which is caused by stress.
Anne's husband, a teacher, had been living with depression for almost a year. Kefa's illness was triggered by an incident at work. He responded well to antidepressants for a while, but his depression kept recurring, and in 2018 he took his own life.
Jazz, I want to tell you what I am doing.
Frequent conversations about mental health in her home became a necessity, at least to shield her children from a society where stigma around suicide is very prevalent. Ever since her husband died, Anne says society has been unforgiving.
You're not expected to mourn someone who has died by suicide. My religious leader stood up during the burial and said, I don't want to hear anybody saying anything about this because this young man hung himself. It was presented as if it was a choice. He chose to die. It has been very stressful. There are times I've wanted to shut myself down because you're not sure what questions you will answer that day. There are times you don't even want to walk out and see the world.
People like Anne face a lot of stigma and discrimination. In many African communities, suicide and mental health issues remain a taboo topic, and the real stigma is happening within families, the neighbors, the police, the religious places, and this is making it harder for families to take care of their loved ones who are mentally unwell and to recover if and when they lose them. Some 500 people committed suicide in Kenya between April and June 2021, according to official statistics. Human rights and mental health organizations want to raise awareness on this problem and are actively campaigning for all countries to decriminalize suicide by 2030.
For those who do go through the criminal justice system as a result of a suicide attempt, it worsens the psychological distress. There are no psychology or therapy systems within the prison to support this person. And then when they leave, they have a double stigma of a mental health condition or a suicidal person and a criminal or an ex-prisoner.
But experts say a lot of work also needs to be done within families, religious settings, and communities. They warn that continued discrimination against affected families could lead to mental health issues like depression and subsequent stigma reinforcing in families.
Stigma creates a sense of despair, right, for the surviving family members. But when you feel stigmatized or rejected, you go through depression. So if there were genetic predisposition to mental health challenges, then the environment is also contributing to stress, then you may find that there is a continuous series of suicide happening within a family.
The World Health Organization says that about 1 in 4 people who seek healthcare in Kenya have a mental health condition. Yet, there's very little literacy about the issues, even among primary healthcare workers. In June, the government unveiled a 5-year action plan to boost mental health structures, as well as increase funding. Caregivers hope that this will be used as a step to normalize conversations around suicide in the country as well. Marcy Juma, BBC News, Taita Taveta.
Still to come, Peter, with all the sports.
Yeah, we've been able to watch those 3 videos. So back to you, the moderator, for the discussion. Thank you.
Thank you, sir, for that. For those videos. Like, for me, I'm getting so emotional about the video and about part of the videos, and I'll say that this topic is really, 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 really wide, and we have to really also pass the baton by telling other people about it and seeing how we can work around it and save people. So that's about me. I want us to every other person on this in this meeting and on this call, just to tell us something you got about the 3 videos, something you got and that you're taking home today that stuck with you, that stood out for you in those 3 videos. The 3 videos are interconnected to me, like they are so connected. And I would say mine after you have said yours. So I'm waiting. Okay, Miss Oluwakemi, I can see your hand. Yes, you have the floor.
All right. Good morning, the moderator, convener, the guests, and everyone. Luakemi is my name. So from the 3 videos, yes, of course, I have taken 1 or 2 things out of it. I'll start by the first one. The first video, actually, I saw how, what goes on in the mind and the head of someone that is suicidal, and why they can't seem to maybe overpower that thought, and maybe until they actually commit suicide. And that, of course, it's good to just always speak out, share your concerns with somebody. Like, talk to somebody is like the first step to even being safe. To avoid committing suicide, and why it is important to seek therapies. So that's what I got from the first video. The second one was quite emotional, like you said, the mother who lost her son and all of that. But the part that got me was how you made how having someone like a relative or a child committing suicide. The impact. What I'm trying to say is the impact of that suicidal what's it called? Sorry, let me put my thought together. So the impact of what the boy did on the mother. That's what I'm trying to say. So the impacts, like the guilt and the hunger. I mean, the mother ended up feeling like, feeling guilty, like maybe she could have done 1 or 2 things better. That really made me emotional. Like, I can't imagine that happening to me or any member of my family. It brings you to a state where you feel like, oh, if I had done this, if I had done that, maybe this or that couldn't have happened. And then how she was angry at the boy, at everybody, I can imagine. And then what the lessons, the things she also said about spending time with children, giving them undivided attention and listening to them. I also feel like this actually is like an eye opener for currently a member of my family in Nigeria right now. Something going on with her and how she has been withdrawn from everyone and all of that. I'm sure that after this webinar, I might be able to do better for her. I mean, so then the last video, like the lady talking about the suicidal rates, how it's more or less like a big issue generally. In fact, to an extent, I feel like I don't think um suicide is a criminal offense. Like, I don't know if it's a criminal offense in Nigeria, but at least I heard for the first time that in Kenya is an offense that could give you like 2 years in jail. And I'm like, wow, really? Like the impact of sending somebody that already had a suicidal attempt to jail, the impact psychologically is even just nothing to write home about and all of that. And that we should stop stigmatization and all of that, because the impact on all these people, I mean, it's not going to be a good outcome in the end. Thank you very much.
Thank you for that submission. Thank you so much for that submission. It's really, I don't know. Don't let me talk on yours. Any other person on the call? And everybody has to say something. Everybody has to say something. You can choose to type in the chat box if you don't want to talk, but everybody has to say something about the video. The video is I don't know, challenging to me. Like, it's just giving me different form of emotional um, state, and I can't even put myself together about everything that I've watched. I know yes, you can say something, ma'am. Miss
Oh,
Adanna,
okay.
you can say
Oh,
something. At the
all
floor.
right. Good morning, everyone.
Good morning, ma'am.
Thanks for having me. I'd like to talk about the first video. Something that stood out for me there was the psychiatric doctors. They said something about why people do not seek help is because they are afraid to be termed that they have mental illness or mental disorder. So I realized that some of the factors for suicide is not mental disorder or mental illness. It's not all the people that have attempted suicide have mental illness. So there are some factors that could also affect suicide that is not mental illness. For example, someone that committed suicide because of financial constraints or abuse. They said something about abuse, childhood trauma can also lead to suicide. So that actually stood out for me for the first video. And also the second video about the mother that lost her child. Something that stood out for me was that he was actually showing signs of improvement. He finished from school, he went to college or so, he hung out with the mom, took the mom on a Mother's Day date. So what changed? What changed between the day he took the mother for lunch or whatever? What changed? So I now realized that you might think that people that attempt suicide or people that are suicidal, they are getting better, but maybe they are not. And also from the video, I saw that he also went to a mental health facility, stayed for a while, and then he came back home. So maybe there was no follow-up, because I think how we follow up patients after surgery, we should also follow up people that are suicidal. Once you see improvements, you should also follow them up to know, okay, and also from that video, isolation during COVID was a risk factor for him. That was not identified. Maybe if they continued follow up, or they continued going for the care or to the mental health care, maybe, I don't know, maybe it could have turned out differently. And then thirdly, for the third video, for the decriminalization of suicide, of course, seeking help is better than punishment. As they said, over 700,000 people die of suicide every year globally. And there are different reasons for this. So I believe that suicide should be decriminalized. Someone said, the last speaker said that she doesn't know if suicide is criminalized in Nigeria. It is criminalized in Nigeria. So decriminalization is the first step to prevent suicide. so that the other strategies, the other prevention strategies would work. Because if not, people will not speak up. And because of that, there would be stigma, and the families are also affected. So thank you.
Thank you very much for that submission. Yes, thank you very much. Most of the time, just as you've noted that sometimes it's because of fear of being termed something you are not. Like there's something going through your head, through your mind, and when you speak it out, someone is giving you another thing entirely that is different from what you have. Thank you very much for that submission. Thank you very, very much. Any other submission, please? We are waiting. Okay, about the video, let me speak. Mine is yes, I said while growing up, I actually witnessed one person that our neighbor then, he came home that night. I think it was in the night was it in the night we discovered, or early in the morning. He came back home. I think it was a bus driver or something, and he never got into the house. I don't know who opened the doors that day and discovered that he actually committed suicide. The family didn't really get themselves, and there's this stigma about it, whether we choose to believe it or not. There's this silent stigmatization about it, that be careful about this person, don't near this person, the daddy did this, the daddy did that. And I think in matter of months or so, the family, the wife and the children actually left our area then. So it's not even even to the family that this occurs to. It's the trauma itself is even larger, and the case of suicide can actually cause a ripple effect, and can, as the father committed suicide, the mother was life for, and she also did that, and it's just going round and round to the end of the family. And that's why we have to be so careful about what we say and how we say it, and how we talk to people. I guess the second video, we were told that we should spend time, we should speak our mind. This person has actually been speaking his mind, has actually gotten to a stage where it looks like he's okay. But I guess, according to Miss Adanna, I guess it's because of the isolation, because he went into different stuff, into acts and all that. And I think there was this lockdown really caged him in, and he couldn't really express himself any longer. For people that extroverts, I don't know, that love being out there and all that, the COVID-19 lockdown didn't really go well with them. And if we have someone in that kind of situation, is not going to be fair on them. And I think most of suicide, just as I said, suicide, criminalizing suicide actually is because some of them are cases of mental illness. When I say mental illness, depression. You can't put someone that is already depressed attempting suicide and put that such a person in prison for 2 years, and he will come out again to do what? To kill himself at the end of the day, because it doesn't just as one a particular I think the third video, he said there's no psychological treatment to that. You are putting someone that wants to end his or her life, and you are putting the person into a confinement, and you're expecting that the person will heal up immediately. There's no sense in that. So that's my own view about this discussion on the videos. Esther Adela dropped on the chat box. She said, the video is a lot for me. My question now is, after this webinar, what's the way forward to decriminalize it? And yes, the trauma is more on the people left behind. Yes, we are talking about it. We are doing something about it. You saying it to 1 to 2% and every other person till it gets to the top where they can see reasons that it's not even helping. Even the I think making that law of criminalizing it actually is even the worst part, because it's even making the whole thing worse. I won't speak up and it will just happen, and the person will just find a way to just make it happen, and not so nobody will save him and not be like, okay, it's a suicidal attempt, so go to jail. The person will actually want to succeed committing the suicide. So I think we have exceeded our time. Sorry, would pause on that while we go to let me have one person else. We have men on this in this call, and we haven't gotten any man to talk about this aspect, because I guess men have their hidden emotions. I don't know if somebody's agreeing with me on that. Women express themselves mostly, but men have hid their emotions most times. So I will need a man to say something about it. Please, I'm waiting. Thank you. Oh, Stephen Ikubani. Sorry, I don't know. Maybe I actually pronounced that name well. You have the floor, please. I can see your hands up, please. Mr. Stephen.
Good day, the
Good
moderator.
day, sir. Good day, sir.
Thank you for giving me the opportunity to contribute to the discussion. Before doing that, let me just acknowledge the team and also the leadership of the MHDi for bringing up this webinar. And sincerely, I had hoped that many persons will have taken opportunity that is available now to educate themselves for the future and to also help persons around them that might be needing assistance as regards this very important topic. Well, a lot has been said. I just want to make this brief contribution. And that's the fact that here in Africa, particularly from the scenario of the Kenya criminalizing suicide, I think here in Africa, most are yet to see suicide or mental health as a form of disease. I guess so. And probably we need to start from that. Let people know that it's a form of illness. As a form of illness. So maybe when they know that, they will now give equal or very similar attention to give to somebody who is having cancer, who is having diabetes. We afford persons suffering from mental health issues such care. That's my very brief contribution. Thank you.
Thank you so much for that briefing contribution. Thank you so much. Yes, if our governments actually see this as it is, which is dealing with mental health and all, it would help instead in really encouraging people to speak up and also seek for help. or rather than caging it up, and at the end of the day, we keep having polls of people committing suicide. Thank you all for those wonderful contributions. I really gained a lot, and I'm still emotional. Let's give ourselves a round of applause for this far we have been here in this meeting. I hope you have been enjoying this webinar. I want you to say it in the comment section. How has this webinar been so far? Are you enjoying yourself? Are you gaining something new? So while you type that in the chat box, we're going straight to the next agenda, which is introduction of the guest speaker. Introduction of the guest speaker. Can you hear me now? Hello?
Yeah, we can hear you now.
Okay, so I was going through the biography of our guest speaker. I said her passion for population health led to masters in public health from the University of Southwales in UK. She specializes in health behavior change and health promotion. A range of experience also includes health and safety campaigns, occupational health and mental health trainings, incident investigation, and risk assessment. She's serving as a mentor in one of the largest mentorship global platforms for girls called Girls FTW, where hundreds of young women from diverse races, cultures, and religions are mentored. Our key interests are volunteering, giving health talks, and mentoring. Wow, what a great profile this our wonderful guest speaker has. And I want us to in the chat box make a reaction as I welcome Miss Adanna Ibenacho. I don't know, maybe I pronounced the name well. I'm so sorry, ma. As she has the floor now, giving us the talk on decriminalizing suicide, a pathway towards mental health promotion. So you're welcome, ma. You have the floor,
Good morning.
Miss Adanna. Thank you, ma.
All right, thank you. Thank you so much, everyone. Good morning. Thank you for having me. You can just call me Ada. It's fine.
Okay,
okay. So in 2018 on CNN, I read a story of a guy who was arrested and locked up for weeks. And his crime was that he tried to take his own life. He has been unemployed for years, and he was fed up, and he entered a building site to ask for a job. But instead of getting a job, the security guy pushed him to the floor, and that triggered him. So he decided to jump into a nearby lagoon. When he jumped, fortunately, he was rescued by some fishermen. He was handed over to the police, and he was arrested and jailed. This story was shared on CNN. That was in 2018. So he was unaware that attempted suicide was actually a crime in Nigeria. So he said that if he had known, he could have made sure that he was successful. And we are talking about decriminalization of suicide because when we decriminalize suicide, people will be able to ask for help. It will give an environment for people to ask for help and remove stigma from suicide. My name is Ibenacho Adanna, and I'm a health and safety specialist. I have a passion for health education and health promotion. And I believe that in this presentation, we'll be able to understand fully the risk factors for suicide, because it's not just health factors or mental disorders that affect suicide or that leads to suicide. There are also risk factors for suicide. We'll also speak about the the prevention strategies we have for suicide prevention, and also some mental health goals, some emotional health and mental health awareness goals that we can set for ourselves, so that we won't find ourselves in such situation. So I'm going to talking about firstly about decriminalization of suicide. Decriminalization of suicide strengthens prevention strategies by reducing stigma and shame associated with suicide. When we decriminalize suicide, people will be able to seek for help. People will be able to feel safe to ask for help. I'm going to define what suicide is. Suicide is the act of deliberately killing oneself. And a suicide attempt is when someone harms themselves with any intent to end their lives, but do not die because of their actions. And why are we talking about suicide? Suicide is a mental health issue. It is a mental health issue, which is the 4th leading cause of death among 15 to 29-year-olds globally. Now, when you remove cancer, cardiac disease, and HIV, some other diseases, the World Health Organization has said that suicide is the 4th leading cause of death among people between the ages of 15 to 29. And what are the common methods for suicide? Most of the methods for suicide include pesticide self-poisoning, when people drink sniper, take some chemicals, self-cutting, drug overdose, hanging, jumping from heights into maybe river or lagoon, and drowning, and the use of firearms. And let's look at some statistics when it comes to suicide. They say that 700,000 people die by suicide every year. And as I said previously, that suicide is the 4th leading cause of death among 15 to 29-year-olds in 2019. And also, we have realized that the statistics of people that commit suicide come from low and middle-income countries. 77% of the suicide mortality rate is coming from low and middle-income countries, while the remaining 23% is coming from high-income countries. The risk factors for suicide. Mental disorder can be a risk factor for suicide. I'm going to share, mental disorders. We also have such as anxiety disorders, depression, bipolar, and eating disorders. We also have some history of suicide. If someone has attempted suicide, there is a high risk that the person would attempt suicide again. And also decriminalization based on maybe race, gender. We know that some people have been, as we say, japping for a couple of years now. And some people, when they travel, they face some form of racism, stigma, marginalization. People in the LGBTQ group, they also face discriminalization, and this can also be a risk factor for suicide. Now, there is a risk factor for suicide that people do not talk about much. That is socioeconomic factors that affect suicide. And in the first video that was presented, that we watched, we saw that there are some factors that affected suicide that are not mental disorders. Now, there are some socioeconomic factors that affect suicide, such as financial instability. When someone is not able to get a job, financial hardships. When people are fed up, they've been unemployed for years, and they are hungry, they cannot provide for their families, they do not have a house, they're in debt. I think last year, there was a story of a woman that committed suicide or a man that committed suicide rather, because he was in debt. So unemployment, lower education and attainment, all of these factors are socioeconomic factors that can also, influence suicide or can be a risk factor for suicide. And also chronic pain and illness. People that are in chronic pain, people that maybe they have issues with their health, because of that, they're on a particular medication for pain, they would want to, give up and commit suicide. So that's also a risk factor. Abuse also is a risk factor. Discord, familiar discord, disharmony in relationships and families can also, trigger suicide. And also, I want to talk about alcohol and drug use also can also be a risk factor for suicide. Last year, a family friend's cousin committed suicide. He was an addict. He was addicted to drugs. So he was given a sum of money to take his father to the hospital. His father had prostate cancer. So he took his father for some tests. And after the test, when he brought his father back home, he was nowhere to be found. So they called him, they messaged him throughout the night. They were all worried. And he reached out to my family friend and told my family friend that he was locked up somewhere. So he went to, he met some guys, he took drugs from them, and he could not pay. So my family friend told him, okay, just tell me where you are. I will send you the money, start coming back home. So he sent him the money, he paid those guys, and he came back home. So the next week, his father was supposed to do a surgery. So they paid a large sum of money, I think about 5 million, into his account, because he was supposed to stay with his father in the hospital. So he took his father to the hospital and he stepped out. So after that, they couldn't find him. All through the night, they called him. The next morning, they called him. And then the following day, they got a call that he hung himself in a hotel. Apparently, he spent all the money for his father's surgery. He squandered it. He spent it on drugs. So, but they only treated him for mental illness because he was in rehab for a couple of days and a couple of weeks, and they brought him back home. But that particular risk factor, because drug use and alcohol use is a risk factor for suicide, that was not identified. He was only treated for drug use disorder. So that can also be a risk factor for suicide. Now, let's talk about criminalization of suicide. The Nigerian law on suicide. What is the Nigerian law on suicide? I'm going to read out some of the sections. Section 327 of the Criminal Code Act states that any person who attempts to kill himself is guilty of a misdemeanor and liable to imprisonment for 1 year. That is in Nigeria. And also, Section 231 of the Penal Code states that whoever attempts to commit suicide and does any act towards the commission of such offense shall be punished with imprisonment for a term which may extend to 1 year, or with a fine, or with both. So suicide is a crime in Nigeria. If you commit suicide or attempt suicide, you are liable to be imprisoned and jailed. Now, what are the effects of suicide criminalization? It will make people more successful to commit suicide, more successful suicide rates. People would not want to survive it. They want to commit suicide and be successful and die by suicide because they wouldn't want to be jailed or persecuted or face that discrimination or stigma because of that. And also, it exacerbates mental illness. So if someone is depressed and they attempt suicide and you jail them and persecute them, it will trigger their depression. They will be more depressed. And also, it will lead to underreporting of suicide cases and stigma and discrimination, and also a barrier to treatment and support. People would not want to speak up so that they can get the treatment that they... Okay, I have a slide. I can share it. Okay, please 1 minute. Can everyone see my screen?
Yes, we can.
Oh, okay. So, as I was saying, sorry. And also, effects of suicide criminalization could also be feelings of hopelessness and reduced self-worth. Now, help is better than punishment. That is why we are advocating for decriminalization of suicide. Help is always better than punishment. Someone that has attempted suicide is a call for help. It's a call for you to help the person, not for them to be persecuted and jailed. Now, why do we need to decriminalize suicide? What are the advantages? What are the positive impacts for decriminalizing suicide? It saves lives. It alleviates distress faced by the persons concerned and their families. And also it will reduce stigma. By the time you take out stigma from suicide and suicidal thoughts and suicidal ideation and suicide attempts, then people would feel more comfortable to seek help. And also it helps to inform appropriate interventions. When suicide is being decriminalized, people will be able to report suicide. When there is data and information on suicide, then we would know the interventions that are needed. And also, it enhances opportunities for awareness. You know, we can do awareness, we can advocate all we want, we can tell people to get help all we want, but suicide is still criminalized in Nigeria. And the first step for health promotion is decriminalizing suicide. So, and also it leads to collection of accurate data. By the time suicide is being decriminalized and stigma is removed from suicide, people would feel more confident and more able to, you know, seek help, and would have more data and more information about suicide. Let's look at a case study of Singapore. Singapore did decriminalize suicide. And after 9 months of post-decriminalization, let's see what happened. Was it really an effective intervention strategy? Did this really improve suicide prevention? Now, let's see. In Singapore, the police provided support for over 1,800 people in cases related to suicide ideation, suicide attempts for a year. Now, they had first-line responders that called a 24-hour hotline dedicated to providing mental health support, and they had a staff by trained nurses and counselors. They have trained nurses and trained counselors that gave help to people that needed it. People with suicidal ideation. Suicidal ideation means suicidal thoughts, and also people that have attempted suicide. And also there was an awareness and advocacy that was done. So people with lived experiences shared their stories. And this made the government of Singapore understand that decriminalization played a key role in improving suicide prevention. So the number of deaths by suicide drops in comparison when compared with previous year. So this is an evidence that showed that decriminalization is an effective intervention strategy for suicide prevention. Now, what are the evidence-based interventions for suicide prevention? When we talk about evidence-based, it has been tried and it works. Now, the first step is limiting access to means of suicide, because we know that mostly in Nigeria, people that commit suicide, they use pesticides, they use chemicals like sniper. Maybe rarely they use firearms. It's mostly maybe in the US that most people use firearms, but in Nigeria, most people use pesticides, chemicals. Maybe they jump into the lagoon, or by drowning and all of that. Now, limiting access means we can limit access to these chemicals, because sometimes also when we talk about drug overdose, some people go into pharmacies, they buy drugs that could pose toxic, and the pharmacists, they just, sell those drugs to people. They don't ask any questions, no questions at all. And also people buy chemicals, pesticides in large quantities. People don't ask questions. So by the time we limit access to this means of suicide rates would reduce. And there is no evidence to suggest that. There's no evidence to suggest that when you reduce one means of suicide, the other means will increase. No. Now, also identifying suicide risk, proactively identifying suicide risk by healthcare professionals. Now, there's evidence to suggest that half of the people that have committed suicide or have died by suicide or attempted suicide visited a primary healthcare center weeks before they committed suicide, days before they committed suicide. Maybe they were admitted, maybe inpatient or outpatient care. Maybe they were admitted, they went to hospital to complain maybe about something that doesn't relate to mental health. There's evidence to suggest that people that have committed suicide sought care, primary care, even if it was not mental care. So healthcare professionals can also be proactive in identifying risk of suicide in patients. So, for example, when we go to the hospital, maybe we complain about malaria, typhoid, pains, and all of that, the doctors can also ask questions If they ask questions and see that maybe this particular illness or problem you are having is a risk factor for suicide, they can refer to experts. They can refer for expert care. So this is also an intervention that would work to prevent suicide, that could work to prevent suicide. And also, this is also a means of early identifying it, assessing it, and managing it, and following up those at risk. And also improved follow-up contact after care. That means that, for example, how people have surgery, for example, heart surgery, and there's follow-up care. You know, people, the surgeons, they call, they check up, they follow up, they tell you to come for checkups. The same should also be done for people that have maybe sought inpatient care in mental health facilities that have had suicide ideation or that have had suicide attempts. So the professionals, the experts should follow up. The second video that we watched, the guy that committed suicide, the mother was crying. We saw that he went to rehab and he came back home, and then the COVID happened and he was in isolation and all of that. But I really believe if there was follow-up, how we follow up people that do surgery, we should also follow up people that are high risk for suicide. And also providing supportive contacts. There are helplines, there are help contacts that help, 24-hour helplines that help people that have suicidal ideation or suicidal thoughts and have attempted suicide. And also, they can also refer people to specialized care, either inpatient or outpatient care or mental health facilities. And also situation analysis. By the time we analyze, if we have data in Nigeria and analyze suicidal mortality rates, that's the number of people that have died from suicide, and also which regions, you know, what states have higher level of suicide, what are the maybe by region, maybe by age, maybe by sex, maybe by religion. Okay, is it more Christians that are committing suicide than Muslims? Or by the time we have all of this information would help to profile solutions. It will be an input to the intervention strategies and make these intervention strategies available. And also interacting with media for responsible reporting of suicide. So, for example, most of the news or most of the information we hear about suicide is, you just go online, you see someone has committed suicide because of he was in debt, or someone committed suicide because he didn't have this or he didn't have that, he was going through this. What if you know, the media can change the way they report suicide? What if there's because there are some people that have actually sought help, gotten help, and they're better. Why not report cases of people that have really, you know, overcome their mental health challenges? That will give people hope that they should seek help, that there is help available and they can be better. And also awareness and advocacy. A lot of people do not know that suicide is being criminalized in Nigeria. A lot of people. I know a lot of people do not know. A lot of people. And also, by the time we create awareness, both for mental health facilities, primary health care, doctors, researchers, academia, in schools, when we create awareness and advocacy, it will really help people to seek help. And also, multi-sectoral collaboration. So suicide, because of how complex the issue of suicide is, there are a lot of factors that affect suicide, not just health-related factors that affect suicide. So we need a multi-sectoral collaboration both from Ministry of Health, Ministry of Education, Ministry of Agriculture, when we want to talk about maybe limiting access to pesticide use, when we talk about advocacy, trainings, awareness in schools, telling people about what suicide is, the services that are in place. You also need Ministry of Education for that. When we talk about also training people in primary health care, doctors, nurses. We also talk about Ministry of Health, NGOs, non-governmental organizations. So it is a multi-sectoral collaboration. It cannot only be done by the government, also the government, public sector, Ministry of Health, and all of that. Now, we are going to talk about examples of mental wellness goals. I know that when we start a new year, people have goals. They have financial goals. They have physical goals. They have career goals. But people do not have mental health goals. You know, you can only achieve your physical goals and achieve your financial goals and your career goals when you are sane. Now, I was able to attend a particular training, and in the course of that training, there was a project. That project lasted for 8 weeks. So it was evidence-based. So the project was that you would actually identify and set up 2 mental health goals for yourself and try and see after 8 weeks if you're able to adopt that particular goal and see how it has improved your life. And we did that particular project for 8 weeks, and it has been very advantageous to me. Now I'm going to share some mental health goals. Now, you don't need to wait till you have suicidal ideation, that suicidal thoughts, or you get to that peak of hopelessness, or that peak that you think that nothing, your issues or your situation in life, there's nothing that can be done about it. Because from the previous video we watched, we saw that when you have suicidal ideation, when people attempt suicide, the part of the brain that is being triggered is the amygdala. The amygdala is the area that controls your stress response. It controls fight or flight response. Should I fight or flight? Should I fight or flight? You understand? During that particular phase, as the individual, I'm referring to that video, your frontal cortex, the part that that is responsible for reasoning, it's dormant. It is the amygdala, the part that is responsible for stress response, that is being triggered. So before you get to suicidal ideation, before you get to that phase in your life that you think that you have lost it all, you are hopeless, you are being triggered, you want to attempt suicide, although there is help, there's care, there's help there's suicidal care for people that are in that category. But before you get to that, because public health is about prevention. Public health is about prevention. Medical care is about treatment and care. So before you get to that, what are the proactive measures we can put in place? Those are mental health goals, like sleep. We underrate sleep, but sleeping for at least 7 to 8 hours a day helps your mood, gives you more energy. Doing fun activities, scheduling for pleasurable events, things that make you happy, things that excite you, meditation, practicing mindfulness, stop, breathe, and think. Gratitude exercises, being grateful for life, starting a gratitude journal, using apps for journaling, being grateful rather. And also, evidence has shown that people that engage in religious activities feel better about their lives. Regular religious participation is also beneficial to some people, whether you are a Muslim or a Christian or Hindu. And also some stress reduction techniques like massage, yoga, music, art, hydroaromatherapy, and also laughter. People schedule time to listen to comedy and laugh. Self-care, reading a book, doing your nails, making time for a hobby. The most important thing is that these goals, when you set them, you stick by them, you schedule time for them. How you schedule time to pursue your business or your career or your finances, you also schedule time to do these activities. And also exercise. They say that when you exercise, it increases endorphins. Endorphins are hormones, happy hormones that make you happy. So by the time you exercise and do things that you love, you are happy. And also knowing your triggers. What triggers you? What triggers you? Is it being around toxic people or people that pull down your energy? And also getting help, having a healthy support system. So with all of these things, it is preventative. You wouldn't have to get to that phase of maybe suicidal ideation or suicide attempts. Thank you.
Wow. That's why I can just say, wow. Can we just give our guest speaker a round of applause? Like, all I can say is wow, 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 wow. So, what was your reaction at the end of this wonderful talk? I need reaction, oh please. I need reaction. I need you to clap your hands and say thank you so much. This presentation was mind blowing. Was really really mind blowing. Was Oh, somebody is actually using my word. Wow. That's the statement. Wow. So we'll be going straight to the questions and answer. Thank you,
Okay.
Miss Ada, for the wonderful, wonderful talk. It's really insightful and really mind blowing. Thank you so much. Thank you so much for sharing your thoughts, and we hope that with time we'll keep saying it and it keeps getting to the top until people see it the way we are seeing it, and also appreciate that life and seeking help is better. Just as he said help is better than punishment.
Punishment.
That's actually the keynote I'm actually taking, that help is better than punishment. That is really 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 mind-blowing. So I
Sure.
Okay. So question, Habs, thank you so much for the comments. I know I'm not the only one. Mental health goals. Wow. This person actually using that emoji like wow. Yeah, I can see that. It's actually amazing. Like it's amazing. I know a lot of us came in to this webinar with practically no idea of what we came in for, and we are getting this feedback and also encouraging ourselves once again to sleep 7 to 8 hours. I will try to manage to sleep 7 to 8 hours. I've not been I've not been consistent with that. Yeah, I've not been consistent with that, but I will try and exercise. Yeah, to release the happy hormones. It's time to release some happy hormones. So where you are, I don't know where you are. Anywhere you are, just shake yourself a little so you release some happy hormones. That's so good. Mental health goal. Thank you so much, ma'am. Any questions, contributions? Um, our speaker is here to answer every of our questions. Please let's drop in our questions. I know you enjoyed the lectures as the talk as I did, and it's amazing. So we can clear all or every other thing that we think that we've cleared. Please, if you have questions, please just drop it in the chat box. Or someone is raising a hand. Miss Oluwakemi, are you?
Yes, thank you so much, the speaker. That was quite not just insightful, amazing. In fact, especially for the mental health goal. I mean, it was just like learning something all over again. But this time around, we're going to do better for ourselves. So my question, I want to ask you, um, if you think that decriminalization can be achieved in Nigeria. I ask because, I mean, for somebody like me that does not even know that it's a criminal offense, I mean, I feel like, does the government even know? Even okay, so if they do, what steps have been taken to get them to decriminalize, and do you think it can be achieved? Actually, that's my question. Thank you.
Oh, okay. I'm going to reply that question. So there's a bill, it's called the Mental Health Act, that have been signed into law in 2021. So the bill states is to promote and provide mental health care services in Nigeria, to replace the outdated Lunacy Act of 1958, to protect the rights of those with mental health. Now, the irony of this is that we have this law, and we also have the criminal code that criminalizes suicide. So they contradict each other. So you cannot say you have a mental health act in Nigeria, because there's a mental health act in Nigeria, that protect the right of those with mental health and all of that, and also suicide is being criminalized. So they are contradicting each other. Although in 2022, in February 2022, the House of Rep, they sought to replace the jail term with counseling and community service, although that community service is very appalling, but a bill has not yet been passed. So that is all we know when it comes to laws for mental health in Nigeria. So suicide is still criminalized, although we have a mental health law. So what I have to say is that advocacy should just continue so that this particular bill will be signed into law, the bill to seek to replace the jail term with counseling and community service. So it's just a bill that has not yet been passed yet. So it's as at 2022 in February. Thank you.
Thank you.
Thank you so much for that response. Esther dropped a question on the group chat. Okay, before that, Mr. Samuel dropped a question, said, how do we now make people aware of decriminalization and criminalization of suicide? Since not everybody in Nigeria knows about decriminalization. Like it came, I heard about it by chance. I would say that it's a criminal act to actually attempt suicide. It was actually by chance. So how do we make people aware of that is criminalized and how to decriminalize it actually? Thank you. That's from Mr. Samuel.
All right. Thank you so much. To be honest with you, before I accepted to do this webinar, I didn't know that suicide was criminalized in Nigeria. I did a lot of research to find out all the information, statistics that I used for this presentation. A lot of people are not aware that suicide is criminalized at all. So people don't even know that if they attempt suicide and survive it, they can go to jail. Now, how do we create awareness? Health promotion, awareness, through radio, maybe through social media, creating awareness in schools. That's why I told you that it is a multi-sectoral collaboration. You understand? You need schools, you need to create awareness in schools, in churches, in community settings, religious settings, and also NGOs, healthcare facilities, hospitals, everywhere. People need to know that people that attempt suicide or with suicidal ideation need help. There are a lot of complex risks that are associated with suicide. So that is how we can make people aware. You can start with yourself, create the awareness, put it on your status today. Let people be aware of it. So it starts with us. And also, it is a multi-sectoral collaboration. It's a collaboration. We need to come together to create the awareness. That's my reply to the question.
Thank you so much for that. So, Mr. Samuel, I hope you got that answer. From Miss Esther Delay, she says, I don't want to digress a little, but how do we justify chronic illness and suicide? I mean, the place of mercy killing. That's from Miss Esther Delay. She said she doesn't want to digress, but she wants to, how do you justify chronic illness and suicide in place of mercy killing?
Oh, okay. I think there are some laws that guide that. I think it's just a few countries that they have legal rights for that, like for mercy killing. Yes, but in Nigeria it's not. Most countries it's not legal, it's not allowed. But some countries it is allowed, it is legal. Mercy killing is allowed. But it's not, I don't know. I think personally it's unjustifiable. You get it. But it's the law. The law states that it's illegal. Thank you.
Thank you so much. So let's give a round of applause once again and appreciate our beautiful, amazing, insightful, what other English should I use? Speaker for today. Our first quarter webinar has been a very wonderful one, starting from the video to our amazing lecture. I hope we've all had a new way of thinking, and I hope you jot things down. That's setting your mental health goals. I actually had to jot things down because I really need it. I think is it 2 weeks you said, or 8 weeks to plan a mental health goal?
8 weeks.
Okay, so
It
set
was
8
8
weeks.
weeks.
So we are trying, we'll keep on, we'll try for 8 weeks and see where we go, where we get to. And thank you so much, Ma. That's
You're
all I can
welcome.
just say. It has been an amazing time today, amazing time out today. And we Mr. Samuel said, I love this and I learned a lot. Yes, that's the truth. We learned a lot. Every other person learned a lot.
Sorry, please.
So
I'd like to add something, please, because
okay.
there have been a lot of emojis on the mental health goals. So one thing when setting a mental health goal, you also need to be patient with yourself and also look at the gaps when you start that particular goal. Now, I'm going to use, for example, maybe I want to set a physical fitness goal for myself. I want to walk for 20 minutes every day. And I go to work from 8 a.m. and I come back maybe around 8 p.m. and I'm tired and I'm exhausted. I can't stroll for 30 minutes. Now, that is a barrier already. My work is a barrier. What can I do around that particular activity that can make me walk for 15 minutes or 20 minutes every day? I can say, okay, maybe sometimes from my junction to another junction, I take a bike or I take a bus. Maybe I can walk 15 minutes to that junction before I take a bus to my workplace. When I'm coming back, maybe I'll just drop maybe 5 minutes to my house, and then I'll walk remaining 5 minutes. I've broken that particular barrier. So by the time you set a particular mental wellness goal, you look at the barriers. There must be barriers when you start. So those barriers, you also need to identify them and walk through them. So it will be flexible, should be very flexible, so you'll be able to achieve your goals. Thank you.
Thank you very much, Ma. So set your goals, let it be flexible. We shouldn't beat ourselves down if we actually failed in one. We should just find a way around it and work towards the goal. Thank you so much, Ma. That was really insightful. So we will, okay, from Mr. Steven, he said, insightful appreciation to the presenter for a well-delivered talk. Thank you once again, Ma. Thank you, Mr. Steven, for sharing that. So we'll be rounding up now, and we'll be taking the closing remark from Ms. Mosheke. I don't know, maybe I pronounce it well. Adebite.
It's my name. Mosheke. It's my other name. Thank you.
Okay.
Yes,
okay,
please.
Ma. Yes, Ma.
All right. Thank you so much. All right. On behalf of Mental Health Driving Initiative, the convener, Mr. Daniel Faliti, and all the representatives, I am here to say thank you, everyone, for joining this webinar. My most profound appreciation goes to the moderator and our guest speaker, Mrs. Adanna, Mrs. Ada. Let me just say that. Thank you so much, ma'am. I'm glad that I spent at least literally 2 hours of my time today on this webinar. I would have really regretted missing it, because I mean, it won't be the same if you have to listen to the recordings. I mean, I've learned a lot, and I'm sure every one of us, have done same. You've been able to open our eyes to a lot of things. Like, for example, myself, that I didn't know that it's a criminal offense that you even attempt to commit suicide. Now I know better. I can go out there now and educate people better and all of that. I'm sure everybody is living with one or two things, and it's been an awesome time. Thank you so much. Thank you so much. And I'm just going to say that the mental wellness goals that you listed for us, if I have it jotted down now, I'm going to just start from 1, 2, just take it little by little, just as you have advised, and I advise every other person to do same as well. Thank you so much for everyone that put in 1 or 2 efforts to put this webinar together. I'm glad, and I believe that you all agree with me that it's a success. And I'm using this opportunity to invite everyone here in advance, to our next webinar. And I also want to say that you should help us and invite 1 or 2 people. Thank you so much. Thank you, everyone. It's a wrap. We're closing now. Thank you so much.
Thank you so much from all of us. From me, my name still remains Modupolu Ataiwo, and I'm signing out and saying I love you all. Thank you for joining the webinar. Have a lovely weekend.
Thank you.